Hello, my name is Bhargav,
And I'm Tanush.
and today we will be presenting on brainstroke and its prevention. So, what is a brainstroke? A brainstroke is a condition where the blood supply to the brain is interrupted, and that causes sudden cell death. And as you can see here, millions or hundreds of thousands of people each year are afflicted by this condition, and it causes a lot of both economic damage, but also emotional damage.
Right. There are two types of brain strokes. So there's ischemic stroke, which is the most common type of brain stroke, and this occurs when the brain arteries become narrowed or blocked. Transient ischemic attack is a mini stroke from temporary blockage. And then the other type of stroke is a hemorrhagic stroke. And this is when the blood vessels in your brain leak or rupture. This can result from many conditions such as hypertension, the overuse of blood thinners, and aneurysms. And from the infographic, you can see that nearly 800,000 strokes occur in the US each year. And a stroke is uh, caused by heart structure problems, blood clotting disorders, and hardening of the arteries.
So, as Tanush said, some of the causes of strokes can be blocked arteries or leaking or bursting blood vessels. And that's why it's important to try to mitigate the reasons why you might have a stroke. And the ways you can do that is like getting exercise, eating correctly, not smoking, controlling diabetes. And if you have any of these symptoms, you might have, or um, you might be, uh, you might have a stroke, and that's something that you definitely should um, try to prevent.
Right, so some symptoms of brain stroke are difficulty in speaking and understanding, numbness in the face, arm, or leg, vision issues, headaches, and trouble moving. And you can see that in the infographic for ease.
So, how exactly do you prevent this? So, as I said before, the main ways that you can do that is you follow your dietary recommendations, you control your blood pressure, you control your diabetes, you try exercising regularly, and you follow what your doctor says. And in this image, you can see some of the main things that you can do. And even as little as 30 minutes of physical activity, which is not that much each day, has a profound impact on your health. And for that reason, you should try to get some exercise because you could be saving yourself a lot of pain down the road.
Right, so the best way to identify and prevent the symptoms of brain stroke is to be fast. And this is an acronym for face drooping, arms weakness, speech difficulty, and time to call 911. You can see at the bottom, it shows that the results of a stroke, the stroke acts really quickly, and in 10 minutes it already begins, and in an hour, it just progressively gets worse until 6 hours. It looks like it's almost complete brain death.
So, some of the main ways that a stroke can be treated or prevented is through prevention early before actually getting the stroke by predicting um, people who are at risk, therapy, and then after um, the stroke event, you can have post-stroke rehabilitation. But most research needs to be done to identify the cause of cryptogenic brain stroke cases in order to better treat patients. And here are some of our sources. Thank you.